Hi everyone, this is the overview for growth and development concepts. Stages of growth and development will cover young adult, middle adult, and older adult. You should understand that growth and development occurs in a cephalocaudal direction, from head to toe, from center outward, and from simple to complex. The rate can be individualized from person to person, but the sequence is usually pretty predictable. This happens with young babies when we see them roll over, sit up, stand up, and also be able to walk. These are predictable sequences that we can see in growth and development. You should also understand that growth is physical change in size, and development is our ability to adapt to the environment in which we live. The behavioral aspect of growth, so our personality and our certain traits. Growth and development is also dependent on genetic and environmental factors. Genetics plays a role in gender, physical characteristics, and temperament, while environment will also affect our growth and development based on who we develop as a family, religion, the climate, culture, which schools we attend, community, and the nutrition that we receive. Personality development includes temperament, feelings, characteristic traits, independence, self-esteem, self-concept behavior, our ability to interact with others and adapt to life's changes. There have been many theorists that have attempted to explain the development of these traits. Freud worked on personality development. Erikson's theories worked on, for each stage, a positive and negative side of each stage. He viewed these as critical periods in our life that we needed to accomplish. He also felt that if you did not achieve the positive side of each of these stages, you possibly would not move on to the next stage. We wanted to, with each of these Erikson stages, have our patient be on the positive side versus the negative side. Havinghurst decided that each period has a developmental task. So we'll talk more about that in another slide. Peck felt that physical function decreases, but mental and social aspects increase with age. And Gould felt that the transformation is central theme to an adulthood. Okay, so let's first start with trust versus mistrust on Erikson's 8 stages. I'm going to explain some of the earlier stages so you can understand how this theory works. There's a positive and negative side to each of these stages. So in the infant stage, trust versus mistrust. If an infant is fed, cared for, and loved, that infant will begin to trust. Versus an infant that's abused or not fed or dropped, this infant would build a mistrust for people. This infant that has mistrust may never move on to the next stage. And this is according to Erikson. The next one I want to look at, and there's a video link attached to this PowerPoint, is identity versus role confusion, which is some of like what happens in teenage years or high school years. I've got a great video that's going to kind of explain it. So identity would be the healthy stage and role confusion would be the unhealthy stage. So go ahead and click on that link and it'll explain this with a YouTube video. The next stage is intimacy versus isolation, which is 18 to 25 years old. People should, at this age group, begin to form adult relationships, intimate adult relationships where they have a relationship with another person. They have trust. They can build a life together. Versus isolation. If someone has a job, possibly, but comes home and just is a loner, they don't have friends, they don't go out with other people, they're pretty much isolated. So the healthy stage in this phase would be intimacy. The unhealthy stage would be isolation. In the next stage, as people get older, generativity versus stagnation. Generativity would be the healthy stage, stagnation would be the unhealthy stage. In generativity, I always think of the word generous. If someone is generous, they're generous with their time, they're generous with their money, they might volunteer. This might be the older stage in life where people have more time to develop and to devote to volunteering and such. So the generous stage is the healthiest stage. Versus stagnation, they just are very self-centered, not thinking about anyone else but themselves and maybe worried about how life is going to treat them and not worried about how they can help other people. So stagnation would be the unhealthy stage. As we move forward, 65 to death is ego integrity versus ego despair in Erikson's stages. Ego integrity would be the healthy stage. Ego despair would be the unhealthy stage. In ego integrity, people at this age group want to feel like their life has been worth something, that they have done things in their life that people are going to remember them for, that they have had a purpose in life, that their purpose has been good, and that they are prepared eventually to die, and they're okay with that because they have accomplished their goals in their life. Versus ego despair is someone who is just very unhappy with the things that they've accomplished in their life. They're not yet ready to die. They cannot believe that they have not accomplished anything that they set forth to do. So again, the healthy would be ego integrity versus ego despair. Okay, so let's talk about Robert Havinghurst. So what's your current deal? Where are you at in life? So what are you doing? In Havinghurst's theory, he set expected developmental tasks for each stage of life. He felt that learning is basic to life and that people continue to learn through life. That successful achievement means happiness, and if you're unable to be successful, you would be unhappy in life. The first stage of Havinghurst is the early adulthood. At this stage in your life, you should be selecting a mate, living with a partner, having a family, raising children, managing a home, starting an occupation, taking on civic responsibility, so obeying the laws and such, finding a congenital social group, so being able to relate with your peers. In the middle adulthood stage, adults should be achieving civic and social responsibilities, which is a common thread that kind of runs throughout all of Robert Havinghurst's theory for all three levels. They should also be maintaining their economic standard of living. I am a middle-aged person, and I can tell you that my kids have now moved out. I've made them healthy. Now they boomerang back a couple times, but I have tried to get them out to be productive citizens. It's been part of my job, according to Havinghurst, in my middle-age adulthood. I have more time to myself. I've got more time for leisure activities, more time to relate with your spouse, accepting changes that have happened to me being a middle-aged person. I'm also adjusting to my parents getting older. So this is where I'm at as far as Robert Havinghurst stages as a middle-aged adult. In later maturity, adults should be adjusting to decreased physical strength and health. They need to adjust to retirement, which might be a positive thing, but they also might be adjusting to reduced income. They might have a death of a spouse, which can be very difficult for them to overcome. They also need to have relationships with other people in their own age group. This is another thing that Havinghurst had said later maturity would be healthy for them to do. They also need to meet civic and social responsibilities, and they need to have adequate living arrangements for themselves at this older stage of life. Okay, so the next person is Kohlberg's stages of moral development. This is how we develop our morality or our sense of what is right and wrong. In just a minute, I'm going to have you click on the ketchup bottle, and it's going to take you to a YouTube video to help you understand Kohlberg's stages of moral development. The first stage is pre-conventional stage, where people answer moral questions based on avoiding punishment. It's really quite egocentric, and it doesn't have concern for other people. As development happens and people grow, hopefully they will reach the conventional stage. This is where they would look at moral choices based on the values of society overall. They look to see what society deems as acceptable, and if they do so, they may even be considered a hero. The final stage that Kohlberg developed was the post-conventional stage. This is where people look internally to see what they believe, their personal convictions to uphold justice. In the Heinz dilemma, the wife's life outweighed the drug owner's personal property. This is the highest level of moral development. One thing that you need to understand about Kohlberg's stages, and as we go through young, middle, and older adult, the stage is dependent on the person. Some people will be very stuck in the pre-conventional stage and never move forward. Other people may advance to the conventional stage, and some people may be able to go past that and get to the post-conventional stage. but moral development is really based on each person. Fowler's stages of spiritual development. In religion, people are exposed to things as a young child. We're introduced by trusted people to a combination of images and beliefs, and as a child we begin to develop our spiritual development. People are given experiences, gone to church, have Bible stories and myths and things like that what we've been exposed to, and we begin to develop our spiritual meaning. In the adult stages of Fowler's stages of spiritual development, there are 3 stages. After 18, the young adult is beginning to focus on reality and accept refinement of these beliefs or acceptance of these beliefs based on what they've been told up until this point. The middle-aged adult will move on often to the paradoxical consolidative phase, where they're aware of many different viewpoints and truths, so their acceptance of other people's viewpoints, including their own. And they may also see religion as very much as a comfort when illness, tragedy, or death occurs in their life. At the highest stage, which people may never reach, the individual is able to express principles of love and justice in their life. I also want you to be aware of Maslow's hierarchy of needs. It starts on the very bottom with the physiological needs: breathing, water, food, sex, sleep, homeostasis, and excretion. And it builds on each of these levels, going to safety, loving and belonging, esteem, and self-actualization. We actually use Maslow's hierarchy of needs to help determine the needs of our patients. If I can't breathe, can I go to college? You can definitely make decisions based on that. So Maslow's hierarchy of needs may help you prioritize a patient's needs. This also may become quite helpful on your care plans to develop an understanding for which functional dimension in your care plan is the highest need for your patient. When we're applying growth and development concepts to nursing practice, we're utilizing several theories to understand growth and development issues for our clients. We also, just as there are in pediatric development, certain time frames and different set time frames that should be accomplished with adults during different parts of our life. We use these theories to help explain and guide behavior and understand how we can help our patients to be stronger and better. The adult lifespan includes these generations: the baby boomers from 1945 to 1964, the Gen Xers from 1965 to 1978, the Gen Ys, or what we call the millennials, from 1979 to 2000, and the next generation would be Generation Alpha. We are definitely influenced by our generations in which we were raised. I can tell you that I was born in 1965, the year of the Great Mustang. That is my first car in the picture below. It's a 1978 Camaro. I can tell you that I did own a pet rock. And also I used to make phone calls on a phone that looked like this, where you had to dial and put your finger in and the dial would go all the way around for just one number. We also had something called a party line, which is where you could pick up the phone and you shared your phone line with several people in the area. And if somebody else was using the phone, you couldn't make your call, so you had to wait until it was your turn. Okay, now I'm going to be going over young adult, middle adult, and older adult characteristics. I'm going to include how the systems in their body are functioning, and also review some of the theorists that are currently associated with that age level. According to young adult, age 20 to 40, the body's most efficient around age 25. It's well developed and coordinated, and things are working well. Cognitively, people are able to think abstractly and also employ logic. The theorist for having hers they should be selecting a mate, starting a family, rearing children, and starting an occupation. According to Erikson, you should be in the stage of intimacy versus isolation. You should be able to, with intimacy, form intimate relationships with others that are healthy relationships, versus isolation, where someone works but possibly does not have any social groups or associate with other people, and they pretty much are isolated and living alone, except if they have to go out. Remember that Fowler and Kohlberg, these are two different theorists, that the level of development depends on the person. For the young adult, there are many health risks, including injury and violence. We want to look at this age group and be sure that we're addressing these different health risks to ensure that we're trying to help them be as healthy as possible. Several things that we might need to address in this population is substance abuse, suicide, sexually transmitted diseases, eating disorders, and also malignancies. There's some top ones listed here. As far as health promotion and assessment, we want to make sure that these young adults are getting their annual physical exams, that they are having vision and screenings for hearing, that they're getting immunizations including HPV vaccine, that they should have yearly pap smears and breast exams for ladies, and testicular exams for men. We should also make sure that we're having them wear their seatbelt, that they're aware of gun safety, that they're aware of getting enough sleep, and that their nutrition and exercise is at the peak for their performance. For this test, I want you to pay attention to the different tables and boxes in your book that outline the health promotion guidelines at each stage and also the physical changes that occur for each stage. On page 358, table 22-1 outlines the different changes that occur in a middle-aged adult, as according to their physical changes that you need to know. If we gave you a test question based on physical changes that occurred, you need to know what age group we're talking about. I've outlined some of them here. I've not listed everything, so be sure that you're looking at these tables in your books. Regarding middle-aged adult cognitive development, though, memory and problem solving are still maintained. According to Havinghurst, remember that this is a stage where middle-aged adults have already had children that are grown and moved away. They have more time for themselves. They're accepting some of the changes that are occurring in middle-aged life, and they're also adjusting to aging parents. Remember Erikson's phase for this stage, generativity versus stagnation. People are more generous with their time, their talent, and also their money. They're able to have productive lives and feel good about the things that they're doing, versus stagnation, where they're only thinking about themselves and only concerned with the things that occur only based on their own beliefs about themselves and what could benefit them. Remember Kohlberg and Fowler's development. So Kohlberg is morality and Fowler is spiritual development. Those develop based on each of the person's ability to achieve the highest level of those different developmental theories. For each of these age groups, you should also be familiar with some of the changes that would occur and the risk factors that are affecting their life. So in middle age, reaction time usually remains about the same, but may diminish a little bit in the later years of this stage. I've listed here some risk factors that could affect their health, and also some health risks that would be a problem for this age group, including injuries, cancer, cardiovascular disease, and also mental health alterations, including stress and anxiety, or even developing into depression. Remember, we want to keep this age group as healthy as possible, so try to get them to have a yearly physical, have visual and hearing screenings, have immunizations that could help prevent disease, and do screenings that could help identify problems with their health early, like colorectal screenings. If they're a smoker, we should do smoking cessation counseling. We should also always make sure we're addressing safety in each of the age groups, and also nutrition and exercise. I've outlined some of them here, but you should look at these 2 pages to be sure that if we ask a question about an older age group and what is occurring as far as changes in their physical assessment, you should be able to identify these changes. Cognitive ability, usually they're able to remember things. It just may take them a little long to remember things. They still have intelligence, problem solving, judgment, and creativity. According to Havinghurst, remember they're adjusting to their new age group. They're adjusting to retirement, reduced income, possibly the death of a spouse, living alone, They should have established affiliation with their people of their own age group, and they should also have satisfactory living arrangements. One thing about that is, remember, if somebody has trouble with bathing, we don't want to just put them in a nursing home right away. Maybe we could have home health come in and see them so that we're not just addressing it by putting them in a nursing facility right away. Remember, we always want to do least invasive to most invasive. According to developmental theories, Erikson's ego integrity versus ego despair applies to the older adult. Remember, this is ego integrity is where the person feels good about the life that they've had. They feel they've achieved the things that they wanted to achieve. And at the time of death, they're okay with death because they know that they have done and had a good life. Ego despair is the opposite of that, the unhealthy stage, where people are not doing what they need to do. They do not feel that their life has been satisfactory, that they have achieved the things that they wanted to, and they're not ready to die, and they're having trouble with that. So we want to always try to get our patients to the healthiest stage of Erikson, which would be ego integrity. Again, Fowler is the spiritual development, and Kohlberg would be moral development. Those stages are dependent on the person to develop the highest stage level that they can achieve in their lifetime. In the older adult, age 65 and older, I want you to be aware of a term called ageism, which is a stereotypical belief that someone can do things only based on how old they are. So click on the word ageism, and it's going to bring up a video that's going to explain this term. Changes that can occur in this population are retirement, economic changes, grandparenting, relocation, facing death and grieving. Health risks that can be associated are injuries, chronic disabled illness, something called polypharmacy, which is where they go to several physicians and maybe prescribe similar or multiple medications that the patient is on based on lack of communication between their providers. Alcoholism and dementia also can be problems with this population. We also get concerned about something called elder abuse, which is mistreatment of older adults, and this can be physical or financial. Health promotion and assessment in this population, I want you to see Table 23-2. This population often has frequent visits to the doctor, needs vision and hearing screenings, vaccinations. We want to make sure that they're having the most functional life possible, that they're having social and leisure activities, that they have the social support of friends and people around them, that they view their life as worthwhile, that they accept and adjust to death of significant others in their life. We also want to make sure that they're able to perform their activities of daily living. We might need to get someone from home health to come in and help them if they're having difficulty with any of these activities. We also want to make sure that they have satisfactory living arrangements, and sometimes if they're not qualifying for as far as satisfactory living arrangements, we may need to move them to a higher level care to get them what they need. Just remember that this progression is always done least invasive to most invasive. Please don't select and put people in nursing homes based on that's the next choice. Home health is an option. Having someone come in a couple times a week, maybe teaching a family member how to help care for them, that's always an option. I want you to understand the difference between dementia and delirium. Dementia is a progressive loss of cognitive function, where delirium is an acute reversible syndrome that can be caused by infection, medication, and dehydration. Both of these can cause changes in judgment, memory, language, and problem solving. One of the most common forms of dementia is Alzheimer's disease. I want you to click on the title of this slide, and it'll give you an example video of a person that's dealing with Alzheimer's disease. There is no known cause for this disease. It's slow and insidious. It's progressive, and they have progressive decline in memory, learning, judgment, orientation, and language skills. As of this date, there is no cure. And the last stage of this, the client will require total assistance and will often be unable to communicate, may be incontinent, and will be unable to walk. Cognitive or thinking development in the older adult. Perception is their ability to interpret the environment around them, and this can highly depend on their senses. If they wear glasses or hearing aids, or if they don't wear glasses or hearing aids and need glasses or hearing aids, it can be a huge problem if they don't have these items. It can even be a safety concern. I want you to know the different types of memory that is associated with the older adult too. There's sensory memory that helps them perceive and understand stimuli in their environment. Short-term memory like a phone number. Recent memory, which is a few minutes to a few hours. And then long-term memory, which usually lasts more than 72 hours and lasts weeks to years. Older people love to discuss what's going on with them in the past and their grandchildren and the things that they've shared in their life. They love to share these items with you. If an adult is going to learn something new, they often need additional time. So it's often good to make an understanding for all of these considerations for the cognitive development in an older adult. I want to leave you with one final thought from Walt Disney. Growing old is mandatory, but growing up is optional. I hope you've enjoyed this presentation.